Just a warning before the video really starts. This video will contain imagery that could be considered disturbing to some considering the topic it deals with. So yeah, just a little warning.
Squamous cell carcinoma.
Thank you, very monotone voiceover. Now, you're probably wondering what squamous cell carcinoma is. Well, to put it simply, it's a type of skin cancer. To be more specific, it's the second most common type of skin cancer, second to that of basal cell carcinoma. So, when considering the people who will be more at risk for squamous cell carcinoma, there are basically three main groups. It's elderly people, or more so to be a bit more specific, people who are around 50 and up. Males are more at risk for it, and just as a general, it's people with fair skin or melanin levels, they're also more at risk. And now on to the symptoms. Symptoms: scaly red patches, may occasionally bleed. An elevated sword/growth, may have a sexual depression, depressed area may occasionally bleed. Wart-like growths, may occasionally bleed. Open sores that don't heal, may have crust, could be on old scars or ulcers. Firm dome-shaped growth. Small horn growing from skin. Scaly crusted large rash patches. That's typically an early form and can be larger than 1 inch/2.5 centimeters. And then changes in existing warts or moles could be signs, or just any changes on existing skin lesions in general could be possible signs of it. So, when considering the causes of squamous cell carcinoma, there's basically just one primary cause: unprotected exposure to UV radiation. This can basically be caused by two things: either being exposed to the sun for too long or the use of indoor tanning beds. And either way, with indoor tanning beds, easy way to avoid, just don't use them. With the sun, that's much harder to avoid considering it's kind of right there or wherever it is. But basically, you can wear sunscreen SPF 30 or higher, or you can just wear layers that cover up your skin more, or just don't go in the sun if you're a gamer, I guess. So, when a dermatologist is seeking to determine the presence of skin cancer, they'll usually look for any strange looking spots or abnormal growths, general stuff like that, or if they want to be certain, because really it's the only surefire way to do it, they'll do something called a skin biopsy. A skin biopsy is essentially a dermatologist or a surgeon or whoever is operating on you will numb the area in question, remove it using a surgical tool, and then they'll examine it under a microscope to determine if there is a presence of skin cancer. Squamous cell carcinoma is a very treatable cancer, at least when it's caught early on. Basically, your dermatologist is checking you, they notice a strange lump or spot, get tested. You have skin cancer, as long as it's early stage, hasn't grown too far or anything like that, and it gets treated quickly, most likely you'll be fine. Obviously, there can be cases where you might not be, it might come back, all sorts of things, complications, this, that, but the real thing is what types of treatment will be necessary. Now, I'm going to list off and explain the different treatments available, but the thing is, this is a general overview. Some treatments are for more advanced growths of the cancer, some for early on. This is just a general overview, as I said before. Treatment options. Excisional surgery. A scalpel is used to excise the tumor along with a small safety margin of normal tissue in order to prevent the overlooking of stray cancer cells, which could be missed if the tumor were removed exclusively. Basically, they cut out the tumorous area, try and do a little normal flesh outside, in case to try and avoid missing cancer cells, because that's not good, that's bad, that's not what you want to do. You'll get rid of all of it, not most of it. Mohs surgery. The surgeon removes the visible tumor with a very small safety margin and then checks on site to see if cancer cells are present and continues to remove the tissue in layers until no cancer can be detected. This one has the highest rate of success as a one-time treatment at 97%. It also removes the least amount of normal tissue compared to other treatments, though the patient is awake during the procedure. So there's that too. Curettage and electrodesiccation, or better known as electrosurgery. The cancer is shaved off using a technique called curettage, then the tumor is exposed to electricity to kill the remaining cancer cells. Basically, scrape it off through curetting, through curettage, and then zippity zappity, no cancer. At least that's the hope. Cryosurgery. Liquid nitrogen is applied to the tumor until it falls off in order to allow healthy skin to emerge once the cancer has been removed. Fairly self-explanatory. Liquid nitrogen, tumor falls off, skin stays good, boom, you're fine. That's always a good thing. Always nice to be healthy and cancer-free. Laser surgery. A beam of intense light is directed towards the tumor to kill the cancer. But the thing is, some lasers will vaporize the cancer, while others will convert the beam of light into heat to destroy it. So, same type of thing, just different types of lasers sometimes. Radiation. Low-energy X-ray beams are used to destroy the tumor without the need of cutting or anesthesia, which is always a plus. Though it may require multiple sessions over a few weeks or daily sessions at specified times to get rid of the cancer completely. Photodynamic therapy, or PDT. A light-sensitizing topical agent is applied to the tumor and is left to be absorbed after some time. After it has been absorbed, a strong red or blue light will be directed towards the cancer to activate a topical agent, killing it while sparing healthy tissue. But afterwards, the patient must strictly avoid sunlight for 48 hours due to the possibility of UV radiation reactivating topical agent and causing severe sunburns. There's topical medications, which are basically just creams or gels such as 5-fluorouracil and imiquimod. 5-fluorouracil and imiquimod can be used to treat the cancer with minimal scarring risk, seeing as it's just a cream or gel you put on your skin, and in theory you would be fine. Immunotherapy. Basically, you're given some drugs to help boost your immune system, strengthen it, so then you can fight the cancer. Chemotherapy. Drugs used to treat the squamous cell carcinoma are given to the patient through an IV drip intravenous, so you get a little thing stuck in you, drippity-droppity, cancer goes hoppity, not really, but basically it works by killing fast-growing cells. But at the same time, hair cells and cells within the gastrointestinal tract grow quickly. So then sometimes patients can develop side effects of nausea or hair loss in turn. Or even both, sometimes. There's lymph node dissection, which is usually done for SCC, squamous cell carcinoma, that has grown larger and or deeper to the skin. Basically, if a lymph node feels hardened or enlarged, then they're removed and tested for the presence of skin cancer. And then after that, there is a chance that radiation therapy may be recommended after that surgery of the lymph node dissection. Targeted drug therapy. Basically, it's a type of procedure, or not necessarily a procedure, but it's a therapy that focuses on specific weaknesses present in the cancer cells, and then these weaknesses are blocked, and specific drugs are used to kill the cancer that is present. So then, basically, target weaknesses, attack, boom, cancer dies, hopefully, because, like I said before, no one likes cancer. We want to be all healthy, nice, cancer-free. And then, again, immunotherapy. Basically, just a recap on that. So it just basically helps the immune system fight cancer by interrupting the process that cancer cells use to make themselves invisible or blind to the immune system. So then it's like, immune system, oh yeah, what a nice day, and they don't see the cancer cell. And then, boom, immunotherapy, wait a minute, that's a cancer cell, I should kill that. And they do, at least that's the expectation. Like I said before, if it's caught at an early stage and treated, then if that happens, they're most likely going to be fine. Researchers in the Department of Tumor Pathology at Gifu University Graduate School of Medicine in Japan discovered that actually proteins play a very significant role in the progression of cancers, including that of squamous cell carcinoma. So that's basically just a little tidbit on the current research and developments that are being made when it comes to the study of squamous cell carcinoma. So learning anything new is always a good sign, even if it's not necessarily good news.
Tylko jedno w głowie mam, koksu 5 gram, odlecieć sam w krainę zapomnienia. W głowie myśli mam, kiedy skończy się ten stan, gdy już nie będę sam, bo wiedzie biały węgorz. Tylko jedno w głowie mam, koksu 5 gram, odlecieć sam w krainę zapomnienia. W głowie myśli mam, kiedy skończy się ten stan, gdy już nie będę sam, bo wiedzie biały węgorz. Ja pierdolę, ale mam zjazd, nie chwytam gwiazd jak kłoda leżę. Nie wierzę, co się dzieje, jak kura z głodu pieje, jak wilkołak do księżyca, w głowie dziury jak ulica przed twoją chatą. Rozpuszczam się jak baton, który leży na blacie. Zejście jest jak nie wciągacie, bracie, kurwa, rymi krzywi. W głowie burdel jak w TV, mnie nie dziwi taki stan. Brak towaru, w myślach ćpam, radę dam albo nie dam. Wszystko kurwa z chaty sprzedam, w sumie mam już przejebane. Wszystko jednak jest sprzedane, ja pierdolę, same długi. Kinol jak u tabalugi, dzień drugi bez walenia, gdzie jest wąż, biała chemia, jebane zejście tak wykańcza, jakby w chuja diabła cię szarańcza. Tylko jedno w głowie mam, koksu 5 gram, odlecieć sam w krainę zapomnienia. W głowie myśli mam, kiedy skończy się ten stan, gdy już nie będę sam, bo wiedzie biały węgorz. Chemia party, chcę na narty, do dealera, a nie w Alpy. Orzesz kurwa, chyba fiknę, jak w Nohala nic nie psiknę. Tak bardzo chcę dotykać gwiazd, ale nic z tego, bo mam zjazd. Totalne kurwa mega zejście, a marzy mi się smoka wejście. Masz hajsy? Ci też zalegam, no to chuj, dziś już nie biegam. Chcę mieć kopa jak pantera, w krechę nie ma u dealera. Już nie, na pewno nie, chyba śmierć rozkłada mnie. Nic nie przełknę, mam deszcze, kurwa mać, ile jeszcze będzie trwał ten stan. Śni mi się koksu van i hery gram, tak dla smaku. Chcę się wozić w Cadillacu, myślami po znajomych biegam, lecz każdemu co zalegam. Odpada opcja pożyczki, bo przycinam jak nożyczki. Tylko jedno w głowie mam, koksu 5 gram, odlecieć sam w krainę zapomnienia. W głowie myśli mam, kiedy skończy się ten stan, gdy już nie będę sam, bo wiedzie biały węgorz. Syf jak na Discovery, chcę wystrzelić jak z Givery. Chcę hery i inne bajery, w nosie pustka, słychać szmery. Macie numer do Gargamela? Może u niego w kotle jest hera, wiem. Głupoty pierdolę, ale nie mam nic na stole, a w kieszeni jebana pustka. Przydałaby się wtotka szóstka, albo chociaż jakaś czwórka i bym leciał jak jaskółka, jak pszczółka Maja. Do ucha śpiewałaby Mikaja, to są jaja. No nie wierzę, wygięty leżę jak zdechłe zwierzę. Gorączka w kurwę się nasila, poharatany jak dupa fakira, jak zdzira wymiętolony. Leżę kurwa rozpalony, hej Johnny, chciałbym posypać i na łące jak królik brykać, ale cały czas ten zjazd usycham jak wyrwany chwast. Tylko jedno w głowie mam, koksu 5 gram, odlecieć sam w krainę zapomnienia. W głowie myśli mam, kiedy skończy się ten stan, gdy już nie będę sam, bo wiedzie biały węgorz.